As she rightly pointed out, this is a major concern. In fact, to address this, the country as such had, under the leadership of the Honorable Prime Minister, had launched a program by name Ayushman Bharat. It's a more or less a combination of, it's more like an insurance part where the state governments are also involved in settling the claims. The funds come from central government, but it deals with 1,000 procedures or so. That is not sufficient, it's inadequate. So in the state of Andhra Pradesh, we have widened that scope, and we have come up with our own insurance scheme. It's called YSR Arogyashri scheme. I named it after my father because that's the kind of priority that I give to that scheme. So I just want it to be remembered, and I want to do a good job out of it. So what we have done is we've scaled the number of procedures to 2,446. From 1,000 what the central government supports, we increased that to 2,446 procedures. And practically, we have distributed cards to 1.44 crore houses. And we've increased the limit for the eligibility of this card to income limit of 5 lakhs per annum. So anybody whose income is less than 5 lakhs per annum is eligible for this card. And 1.44 crores out of the total households of approximately 1.5 to 1.53 crores cards that households that we have, 1.44 crore cards are covered under this scheme. Okay. And last 3 years, we've helped almost 25 lakh people get treatment free of cost here.
We have about 10 minutes. We're going to fly through a few more questions briefly from the audience. The Executive Director of UNAIDS is in the audience with us, Winnie Byanyima. I think she would like to ask a question. If we can get a mic to her at the back there with the black head wrap and the red top.
Thank you, Zinga. Thank you, moderator. Okay. And thank you, panel. Mine's not a question, it's a comment. And responding to the subject you're talking about, I don't think that we're going to be on track to resolve a health crisis that turned into an economic crisis without tackling the inequalities that drive them. We are not health security strategies that neglect some people and protect a few privileged won't protect anyone ultimately. What do we need? We need debt cancellation, and we need to drive special drawing rights of the IMF towards developing countries so that they can have the resources to invest in health, in education, to end pandemics, COVID and other pandemics. We need, let me put it this way, debt repayments for the low-income countries in the middle of this crisis, where several times over they are spent on health, 9 times for Africa, 9 times more to debt repayments than to investing in health. This can't be a solution. So we do need to get rules of finance, rules of trade, and rules of tax, global rules, to work for developing countries if we are going to come out of a health crisis and an economic crisis. Thank you.
Thank you very much for your time. I saw there was a hand here. Questions, and thank you to our panel for answering them so well and really taking a look at what we need to do in terms of policies, practices and partnerships to strengthen health system sustainability and resilience now and in the future, and sharing your experiences. I think what's come out is the importance of primary health care, collaboration with sectors, the importance of prevention and innovation, and getting ready for whatever may come. It's been a pleasure facilitating this conversation. Good morning. Thank you. Thank you.